as well as other consequent wars in Lebanon, have left countless buildings completely destroyed, in addition to abolishing the infrastructure of the country by targeting the airport, bridges, ports, roads, fuel warehouses, and power stations. This has resulted in almost 1 million people to be displaced, as well as in an immense economic and social loss, whereby the citizens were constantly living in fear and frustration. To satisfy the growing need of the population, in 1985, the official foundation of the Armenian Relief Cross of Lebanon, Boulghourdjian Socio-Medical Center, took place by the generous donation of Boulghourdjian brothers. Other contributors were Alek Manugyan, Bread for the World, Mr. and Mrs. Agop Esmerian, Armenian Relief Society Central Executive Board, ARCL Megri and Nairi branches, as well as Tanjugyan family. In May 1987, the official opening ceremony took place. Although Armenian Relief Cross Boulghourdjian Socio-Medical Center had prepared all necessary provisions to aid the surrounding population and the displaced, there was no way to provide social and medical care to all in need. Therefore, ARCL stepped up measures to help and cope with the situation. During the crisis, the medications were distributed to patients who visited the center through its 11 departments. Assistance with large amounts of medication, medical supplies and equipment were provided by numerous resources. The ambulances were donated by the German and the Japanese embassies and other individual donors. In 1989, the Italian embassy in Lebanon donated an ambulance, huge quantities of medication and food parcels that were distributed to the needy people, including migrant workers, refugees, and the displaced population. On the occasion of this valuable collaboration with the Italian embassy, a reception was organized by ARCL under the patronage of His Excellency, the Ambassador of Italy in Lebanon at that time, Mr. Antonio Mancini. Besides the relief assistance to the Lebanese population, the Italian embassy and the Development Cooperation, in close collaboration with the Ministry of Environment, assisted Lebanese institutions with a developmental project consisting of the installation of solar collector systems for the generation of hot water. ARCL was one of the beneficiaries of this project, whereby not only ARCL centers' continuous consumption of energy cost was majorly reduced, but also enabled ARCL to preserve the surrounding environment. Musculoskeletal disorders are major health problems. Complementary to health services, physiotherapy department was established by individual donors. The radiology department consists of the X-ray, mammography, panoramic, echographic, and bone densitometry services. A new medical X-ray processor was financed by Bosnoyan family in the memory of their parents, Zorik and Rita Bosnoyan. Rita Bosnoyan has been a member of the ARCL Regional Committee and has chaired the Committee for Artisanal Art for 26 consecutive years. The Bosnoyan couple were strong supporters and believers in the important role of the ARCL Boulghourdjian Socio-Medical Center. The laboratory provides specialized medical tests. 40 doctors with different specializations serve the patients through clinics. The increasing need for dental care urged ARCL dental departments to gradually expand their services to 4 dental units. The Public Health Department was established with the goal of improving the general health and well-being of the community. Complementing our diagnostic and therapeutic services, it places great importance on preventive programs such as awareness-raising lectures, free medical checkups for diabetics, vaccinations, physical activity sessions, and blood donation campaigns. Social Services Department assists the needy families with health, social, and educational services. The department collaborated for the child labor elimination school dropout prevention programs. In July 2005, ARCL signed a letter of understanding with UNFPA to start a pilot project in Lebanon for preventing reproductive tract infections among adolescents and youth. An advisory committee was established for the project from the Ministries of Education, Social Affairs, Public Health, UNFPA, and ARCL. The pilot project was financed with a sum of $63,000. This UNFPA pilot project gradually broadened its spectrum in Lebanon and expanded its collaboration with 11 other health centers. UNFPA continued this project with UNICEF for operationalizing child and adolescent protection, partnering with St. Joseph University Health Center for its implementation. Continuous training sessions on peer-to-peer interventions were organized with various topics related to reproductive health care. The Social Service Department of ARCL was renovated and a youth club was equipped with the appropriate sound system. ARCL Boulghourdjian Socio-Medical Center is currently a youth-friendly center where it provides different types of assistance, guidance and counseling to youth and adolescents. ARCL Boulghourdjian Socio-Medical Center is glad to announce the launching of this program in the presence of representatives from UNFPA, UNICEF and the community leaders. The Social Department of ARCL coordinates the distribution of a hot plate of food twice per week. ARCL's kitchen was established in 2003 through the financial donation of the British Embassy in Lebanon. Its improvement and maintenance was enabled through the financial support of Boulghourdjian municipality and individual donors. The continuous support of the Boulghourdjian municipality broadened the scope of ARCL by financially supporting various services such as hot plates, the ear, nose and throat department, and the emergency department sterilization section. The Ministry of Public Health selected 25 public health care centers out of 170 that passed the accreditation evaluation conducted by Canada Accreditation. The ARCL Boulghourdjian Socio-Medical Center complied with the 245 international standard criteria for primary healthcare centers and made the necessary adjustments.
نشهد في هذا المركز على إرادة الإنسان وقدرته على أن يبدع وعلى أن ينجز ما عجزت عنه ربما دول وهيئات. وإدارة هذا المركز الذي أثبت لتصل إلى حدود المستشفى في بعض الأحيان على مستوى استيعاب العدد وعلى مستوى الخدمات ونوعية الخدمات التي تقدم، حيث أن شهادة دائرة الرعاية الصحية الأولية في وزارة الصحة تؤكد أن مستوى الاعتماد لهذا المركز هو من المستويات التي نعتز فيها على مستوى مراكز الرعاية الصحية الأولية في لبنان.
On 18 January 2013, ARCL Boulghourdjian Center received an award in UNESCO Palace from the Lebanese Public Health Minister as being the only primary healthcare center selected in the Matan region to uptake and follow the accreditation process. The ARCL Boulghourdjian Socio-Medical Center's administration expressed their acknowledgement to the doctors, medical staff and employees of the center for their continuous hard work and input for the improvement of our center that resulted in receiving this award from the Ministry of Public Health. The ARCL Regional Committee, ARCL Boulghourdjian Socio-Medical Center, and the Public Health Committees are thankful to all individual donors for their continuous support and express their gratitude in acknowledging the contribution of local, foreign, governmental, non-governmental, and international organizations. The Armenian Relief Cross in Lebanon is a private, voluntary, non-profit women's organization founded in 1930 and officially recognized by the Lebanese government with Decree number 2103. ARCL is part of the 26 chapters of the Armenian Relief Society, distributed over 26 countries. The Armenian Relief Society was established in 1910 in Boston, USA. It has 26 chapters around the world with 211 branches. The number of its volunteer members worldwide total to 14,907. To all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as ever you can.